Hey everybody, Dr. Rob here, Facebook Live, Amazon best-selling author of Inside Out Health, a revolutionary approach to your body. Let's update concussion. I'm very excited, but a little distressed in the updates that we just got. But concussion, usworldnews.com just December, a few days ago, actually put out some new updates on what people should adhere to in concussion. Number one, they try to tell everybody what to do if you suspect your patient or your student or your child, your niece, your nephew has a concussion. Number one, symptoms appear soon after an injury. The symptoms can appear virtually immediately after concussion. So there's different grades of concussion. I want to expand on all of these for you. Grade 1 is when you have symptomology less than 15 minutes. Grade 2, you have symptomology more than 15 minutes. Both of them have no loss of consciousness. Grade 3, loss of consciousness. Now, you're going to find out that the literature says only about 10% of the people, thank goodness, lose their consciousness. So the type of things that you're going to see is inability to respond to a verbal command, balance issues, other issues of really not only not responding, but not knowing where you are. So it's a real interesting thing. The idea of, I got my bell rung is truly correct, because the literature now dictates that getting your bell rung refers to the idea that studies have shown that your brain functions at different frequencies post-concussion. So therefore, it sounds like there's a whole bunch of bells, like 3 or 4 Liberty bells, if you will, that are in your brain. So symptoms appear soon after an injury. Do you know how quick brain cells start to die after a concussion? It's within 6 hours, Brown University. Not only that, but tight junctions in your gut, because your gut and brain are intertwined, as we all know. 6 hours after concussion, your tight junctions are now damaged after a concussion. 3 hours after concussion, something called lipopolysaccharide, LPS, which holds the gram-negative bacteria in the inside of your intestinal tract. When LPS is expressed, it leads you down a path of systemic inflammation. That LPS is released in 3 hours. The release of that LPS does not allow you fully to recover from a concussion, because it doesn't allow you to release something called BDNF, brain-derived neurotrophic factors, in your hippocampus. Sounds real technical. The bottom line is, your injury from a concussion, your symptoms are almost immediately, and you start on a deleterious path. When you hit your head, you damage your gut. That poses an issue. Without addressing your gut, in addition to addressing your head injury, you're never going to get clinical outcome. You're never going to recover properly from a concussion, and that's one of the biggest problems. So let's go to number 2, what they said. Remove the player from the field. That is critical. When in doubt, sit them out. Do not, under any circumstances, let them go back in, especially if they're a high school pee-wee kid. As a matter of fact, the literature is specific that if you're under 12 or 13, you shouldn't be tackling anyway. So with that being said about removing the player from the field, some tests that are really good. And I know somebody already wrote a question about tests. Anybody ask any other questions about the test, or just that one that they were sent in?
Just the one.
Just the one. Okay, so with the tests, what you want to do is, so many people, and I'm going to tell you the best tests later, so many people ask about the King DVAC test, which Mayo Clinic likes so much. King DVAC test has really been shown not to be that effective. There's a lot of false positives. So with that being said, it's only truly good to confirm another medical diagnosis. Other tests, like the SCAT test and the balance error scoring system, aren't great tests, because they're not great tests for the simple reason that once after athletic event, they become very false positive or false negative. They're not very efficient tests. We'll talk about it a little later. The VOMS test is the key test. Really, if you want to test if they had a concussion, it's the visual oculomotor screen. Seek immediate medical attention. Great idea. What you really want to do is, you do want to try and get it diagnosed. You do want to ascertain if, God forbid, they have some sort of true traumatic brain injury where there's some sort of brain bleeding, very small percentage. So you do want to seek medical attention. You want to find out and get it diagnosed. And not only should you seek that medical attention, speaking to what we spoke about before about how quick things become deleterious to overall health, you really want to ascertain if they had a concussion and get them on a very quick treatment plan. Educate the parents about the dangers of concussion and what to watch for. One, you want to see what the parents should know to look for. You want to show them what to look for so they too will understand if the athlete or their child comes home and they're showing signs of a concussion, what to do. In addition, a study came out and was very revealing in that only about a third of coaches, parents, and high school athletes knew that a concussion had something to do with the brain. I'm not really sure what they knew in the other 2/3 of the instance, but only 1/3. So that speaks volumes to the idea of education and let everybody know what a concussion can do, what are the signs are. Number one athlete that gets a concussion, a female soccer player. Women are much more susceptible to concussions than men and take about twice as long to respond. So check your female athletes. In addition, require a doctor's evaluation before the child returns to the field. Absolutely. So many, I think in the NFL, it's 93% are able to come back within a week. There's something called myelin. Everybody's heard of the myelin sheath. Myelin incorporates the nerve. Well, in most concussions, the myelin loosens 2 weeks after a concussion. So with that being said, it's 2 weeks after concussion. It takes 2 months for it to heal. Clearly, you want to seek an evaluation. You want to get a diagnosis. And you also want to let a certain amount of time span so you can really see where the patient is, where that athlete is, and ascertain what's going on within that athlete. This is just a brief overview. It's good that it's back in the news. It's always in the news. It's good that the U.S. World News is starting. I added all these other things in, so they have a basic starting point now, but still, if it was to me and I was writing the article, I would like to see a lot more leading edge and cutting edge stuff. So do we have any questions that they've sent in since I started?
No, but I have some questions for
All right, so we always have these questions that people, that we send out to our follower base, what they want me to answer pertaining to the title. So we're going to answer those now.
Give me your top 5 supplements for concussion.
Top 5, I guess they mean nutritional supplements for concussion. In no order, here are the 5 things that I would recommend. Number 1, magnesium L-threonate. Magnesium L-threonate has been shown to decrease brain aging by 9 to 14 years. In addition, it's also shown to make 15% more bioavailable magnesium in the brain and 50% more in this blood cerebral spinal fluid. In addition, it's shown to decrease the incidence of Alzheimer's post-concussion, which is typically very high, decrease that incidence, especially with the people with the APOE4 gene who have that genetic disposition towards Alzheimer's, by 50%. So magnesium L-threonate, number 1. Number 2, specialized pro-resolving mediators. They are without question the backbone for enabling the resolution of inflammation. They change the dynamic in the brain from an inflammatory brain to a resolving inflammatory brain, because your brain's on fire when you have a concussion, and it's damaging all the particles inside the neurons and such. L-glutathione, or what I like to call liposomal glutathione. Liposomal glutathione, without question, is a great choice because glutathione has been shown as the master antioxidant to decrease 70% of brain tissue damage. Number 4, not in that order, but number 4 is critical for EPA-DHA. It's truly been shown to be freeze.
No, it's just flipped over for some reason.
It flipped over, okay. EPA-DHA is a critical element because, DHA is great for cell membrane health, and it's also shown to be an excellent choice post-concussion to enable everything to come back and heal, that being the structures in your brain and your neurons and such. And one of the biggest takeaways is if you have a patient or you yourself are playing a sport that you're susceptible to a concussion, you should take EPA-DHA, several grams, because that has shown to enable you to decrease your incidence of concussion. And last but not least, turmeric, with the most bioavailable ingredient called curcumin, that's shown to be truly anti-inflammatory. And in addition to being anti-inflammatory, it is also stimulating a pathway called the NRF2 pathway, which is a great antioxidant pathway.
I'm just going to flip you over.
Flip me over. Did I go upside down?
Yes.
Oh, you did? You got to hold me? So do you want to hand me the questions that they sent in? I can read them, and this way you can be the camera person.
Okay.
Thanks.
We'll
So we have these here, and let me know if anybody else comes in. Dr. Rob, share with me your best 3 tests for concussions. Number 1 test you can do right on the sideline is the VOMS screening. We talked about that before, visual ocular motor screen. You can just download that. It's great. It's 2 or 4 pages. Number 2 is what we call a tandem gait. It's kind of like the old walk a straight line, heel to toe in front. If the person starts to wobble, they have a balance issue, and they may have not had a balance issue before. It may be indicative or can be indicative of a concussion. And a great blood tests. A great blood test would be by Cyrex or Ray 20, if you can get them in, where you can look and see if the blood-brain barrier has been compromised. If the blood-brain barrier has been compromised, you now know that you're having some issues, and that is actually one of the first signs towards Alzheimer's if that blood-brain barrier is compromised.
We actually got a question in.
Sure.
Can you get a concussion from falling and cracking the back of your head?
Can you? Yes. So the word cracking scares me. It sounds like you're cracking your skull, but you mean can you fall and hit your head? Yes. And can you, the real question, and the new thing is, can you get a concussion or are you able to have concussions or damage like brain and concussions if you don't have a true concussion, but it's traumatic injury and lead in everything like that? And the true answer is yes. So yes, if you fall on your head, you get a concussion. It's very conceivable. But more so than that, you can get all the damaging effects of a concussion from not one strike to your head, but multiple strikes to your head. Anything else? Or can we move to the next one?
Yes.
Can you give me some of the side effects of a concussions not occurring in the brain? So I think what they mean by that is yes. So one of the big takeaways here is when you get a concussion, you have gastrointestinal upset. So it can lead you down a path of getting leaky gut. Up to 60% of people having a concussion can also have SIBO, small intestinal bacterial overgrowth. Huge takeaway. You also can damage something called, and you guys can all see me talk about this at the Integrative Health Symposium in February of 2019, the HPA, hypothalamus pituitary axis. It can damage that. So you can have this cortisol release, and there's a direct tie-in between the two. So yes. And last, there was another question. Does concussion lead you to other neurodegenerative diseases? And the answer is yes. One of the most common, unfortunately, is Alzheimer's. And as Dr. Dale Bretson once said, that we know a lot of people who have lived through a heart attack, cancer, and the like, but we know no one who survives Alzheimer's. So anybody who has a concussion, especially if they have the APOE4 gene, go test for that, is much more susceptible to Alzheimer's. Do you have any other questions, or this covered everything? So we had a little technical stuff. That's cool. Guys, it's getting close to Christmas. Here's what we're going to do. Thursday, tune in. We're going to do a special health tip of the day, which is going to be a Facebook Live pointed towards all at Christmas and what to eat on Christmas. Do me a favor, like this, share this, make a comment. Let's get this great information out. If you have any questions, feel free to reach out to me. Dr. Rob, always yours in health.